I'm Johnny Johnson, pediatric dentist. Bicycle accident took me out of practice. Had to have my wrist fused completely, and I lived in practiced in Clearwater, St. Petersburg area, Florida, 1 million people in the county. This kind of might sound familiar to you, that we have in 2011, our county commissioners, 7 of them, 4 of them decided to vote fluoridation out of the water for over 700,000 people, like Birmingham area, 770,000, depending on the water there. Water fluoridation is never voted out over science. Anywhere in the world, Israel, Brunei, here, never, has nothing to do with science. It's always political or personal beliefs. So let's just get that out of the way. I do want to talk to you about the science behind fluoridation, but the way we talk about it, and I do the same thing if I'm talking to dentists, hygienists, physicians, lay people. This presentation that I give folks in North Carolina, a governor's task force to advise the governor on special needs kids and how to best take care of them. They were able to bring me to do a remote presentation on water fluoridation, and we got done. They were like, that makes sense. It wasn't health folks, it was lay people, and they said, can we take this to the governor? I said, you can have anything you want, absolutely. Quick question for you. Do you know the fluoridation status of Montgomery? Your water fluoridated here? Do you know the level? Okay, it's pretty good. Okay, well, it's in and around there. It varies. It's like driving a car.
We make sure to say right about that.
Right. So it is interesting that Montgomery, being the capital of the state, fluoridates their water appropriately. It's very interesting also that Washington, D.C. fluoridates their water appropriately. 100% of Washington, D.C. is fluoridated. But places around the country, folks are saying, well, we don't want to have it because it's making our kids stupid. Well, it's okay to have it. It's okay to have it in our own places, yeah. And their kids aren't stupid, and they're not stupid. So I'll go into a little bit of that. I just thought I'd throw that one in there to begin with as an icebreaker. Okay, let me just move this. There we go. When I'm not here, I'm out on my farm. I have a pine tree farm down in Florida, planted pine trees. Gracie is my girlfriend in the middle. My wife's taking a picture. I actually don't just have a girlfriend. On your left side is 10 o'clock. That's one of the boars that we have wild feral hogs, like you guys have some here. 10 o'clock was there since I bought the property, and he only showed up on game cameras at 10 o'clock at night. Very smart, very smart. Like humans, sometimes women get us into trouble, and he came out to mate with a woman one night before it was just total darkness, and he met with his maker. The one on the right side is me when I was given, and I'm not bragging, there's other things on the mantle there. I was given the President's Award at the ADA for the fluoridation work that I do across the United States. You see where I took the picture of, and I was proud of that 8-point in the back. For Florida, that's a huge deer, and he's on the registry in Florida. So that's, don't tell Brett Kessler, Brett, if you're watching the past president of the ADA, that's kind of sitting with some other awards, because to me, what is important is the end point. Where are we going? What do we want to have accomplished? That's all that matters. Nothing else does. When we talk about water fluoridation, we don't want to jump right into today. We don't want to jump into 1945, that's when it began. We want to understand the history and tell this to people. They do not understand where fluoridation began. And like penicillin, fluoride's discovery was an accident. Back in 1901, a gentleman moved out to Colorado Springs to set up his practice. We didn't have internet back then. Kind of a surprise, huh? There was a German doctor who was also working with fluoride on an animal model, excuse me, and he had found that fluoride helps to strengthen the enamel and make it less resistant to acid attack. Well, Dr. McKay moved out to Colorado Springs, and he noticed that people there that were born there came in as infants had a brown stain on their teeth that could not be easily removed. And he just was at a quandary, didn't know, called his faculty, they had not seen it. I'm assuming he's a pretty good student because they believed him, and not like me in the bottom third of my class that they would have said, well, you didn't study enough. And so eventually the Public Health Service went out and looked at it. They said they couldn't see anything wrong in the water. Was a common denominator. There's nothing different. Well, fluoride probe wasn't invented until 1930. That's why they didn't see anything wrong. There were other places along the way the Public Health Service stopped in cities that had low levels of fluoride, low levels of cavities, which Dr. McKay found. There were very few cavities. Now, in 1901, people were getting full dentures for high school graduation, and these kids had almost no cavities. And the same in other areas where the teeth looked good without brown stains and had very few cavities. So something was going on. But again, they checked the water, couldn't see anything wrong. There was nothing else at high levels. When the probe was invented, they sent water to be tested. In the Colorado Springs, it was at 2 to 12 milligrams per liter, 2 to 12 parts per million. And in the good-looking cities where the teeth had no brown stains, no obvious staining at all of their teeth, and cavities were low, it was in 1 part per million. So we had discovered something, fluoride being a mineral, that's the 13th most common in the Earth's crust. It's been here since the beginning of time. We stumbled upon an accidental discovery that it is something that helps reduce cavities, just like penicillin was an accidental discovery. We worked to repeat that in 1945 in some cities across the 4 cities that were test cities. Fluoride's in all water to some level. For water we use, it's usually too low to be a benefit for dental health, so it's adjusted upwards to the optimal amount. The cities that were the control cities did not adjust their fluoride level in the water. Within about 11 years' time, the cavity rates between the control cities and the test cities fell 60%. Well, it was supposed to be, I think, a 15-year study. 3 of those 4 control cities jumped off and said, we're on it. We knew there was no health issues, no problems. So you can't deny that. It's like saying, no, this is a smoking test, and we're going to do this for 15 years. Y'all keep getting cancer. They're not getting cancer, lung cancer. You can't say you have to stay on the test because it's inappropriate. It's inappropriate. Crest started selling fluoridated toothpaste on my birthday, so I was very proud of that. I grew up without water fluoridation. If you look close, I'm missing a central incisor right now. I had it removed about 2.5 months ago. I'm going to get an implant. I've got a retainer here, but I kind of slur and lisp with it, so I took it out for today. Just got my driver's license done where I live in a rural city and had my camo on, smiled real big. So for the next 10 years, my wife said, you actually did that? I said, yeah. I mean, I wasn't unusual looking, but it's going to be in my presentations along the way. This is Dr. McKay. I did not even know they had cameras back then, or maybe this is a nice painting of him. But handsome gentleman, he stumbled upon this, got help to figure it out, and that's how we came to discover fluoridation. There's an outstanding timeline that, yes, is still up on the CDC's website. Believe it or not, the CDC website still backs water fluoridation as an effective and safe public health measure to reduce cavities by at least 25% for adults and children over their lifetime. And I say adults, and I will stress that with you. This is not about kids. It is. Kids show cavities faster, they have more serious issues early, but we are adults longer than we are children. So we have to embrace the adult effects of fluoridated water on the crowns of the teeth and in the root surfaces, which are getting more strengthened from hydroxyapatite than they would be otherwise. So adults especially those in long-term care facilities, will have less problems with root surface decay than if they did not have fluoridated water to begin with. And that's the Colorado brown stain that Dr. McKay saw, and we know that is severe dental fluorosis. Okay, so we started where it happened, where it began from. Opponents will like to tell you these companies that make phosphate or aluminum, they had this fluoride left over, they couldn't get rid of it because you can't dump it in the river or the ocean. Well, you can't dump anything in the river or the ocean, but that's what they like to say. So they taught us in dental school that it's good for your teeth and helps to reduce cavities, so they start shoveling it into water systems. You'll hear a lot of claims. I'll go through a few of them, but there's not enough time to go through longer than both my arms put together. The only thing they never claimed is it causes ingrown toenails. I've been saying that since I first began this, when my county voted it out, and we got it back 15 months later. We voted out 2 of the 4 politicians that voted it out of office, and 2 ran solely to bring fluoridation back their first day in office, and that they did. Johnny was done. I have ADHD, anxiety disorder, and underlying depression. I'd have broken out in sweat standing up here just talking to 2 of you. I lost it. And when we voted it out, I lost it. As Matt said, dental cavities are the most common chronic disease of adults and children in the U.S. and around the world. It is more common than obesity, diabetes, asthma, and someone said recently even cancer, which is absolutely correct. We know the impact that people have when they can't focus in school and study. Does that affect their academic outcome? Yes, absolutely. I used to bust my own abscesses. I didn't go to the dentist until I was 15. I was born into a poor family. We did not have regular dental care. I wouldn't brush my teeth until I could scrape it off with my thumbnail. I'd wet my brush. I'd wet my towel and rub off, and the dirt was on that. So yeah, Mom, I took a bath and I brushed my teeth. I had problems all the time, and thankfully they were not painful, so they went untreated. But we know how it affects adults and children missing work. Do you think you would want to come to me missing a front tooth and let me take care of your dental needs or your child's? No, you would not, and I wouldn't blame you. The folks at the bottom, there are this Diamante driver from Maryland, which maybe most of you may have heard, who died. I think it was in 2007 from an abscessed tooth. The gentleman on the right is a gentleman from Russia who was living in the U.S. He's a truck driver. He left the West Coast to go east with a load of things to load to deliver, and do a turnaround and come back. Halfway across, he developed severe dental pain. Stopped, had to get the tooth treated. On the way back, he was in pain again, stopped, and he ended up succumbing to a dental abscess. Sepsis, I think he had brain abscess before his family could even get there to say goodbye to him. So I want you to understand that fluoridation helps your entire body, and it definitely helps cavities. We focus too much on cavities. We're going to change that. Cavities affect everybody. The poorest families get over twice as many cavities as those that are not living in poverty. You have 1.1 million kids in Alabama that live in poverty. 1 in 5 kids that these decision makers pass on the street are living in poverty. And I will say that when I'm in front of whoever's making the decisions, whether it's a water board up in Birmingham or whether it's a city council or a county commissioner, you represent everybody in this community. You pass 5 kids on the street, and one of them's going to have severe problems. So why don't you represent everyone? When you don't, you're not in favor of public health. That reflects in oral health, and you're not doing what your job is. And so yes, we do go political if they don't change their minds, and we do go to the media. Your media is your best source of getting the public health word out. How many of you are in the private sector here? Raise your hands, please. Okay, you're in the minority. It is your job to bring these issues to the forefront. All the folks here, and I learned this the hard way in my first battle, they cannot in public health or even education.gov.edu. They cannot bring these things to a city council and say, look, we are having issues with the fluoride not being put into the water appropriately. Like Birmingham, in 2022, they have 4 plants. 3 of them were not doing it appropriately or had stopped. By the end of that year, by 2023, all 4 of them had stopped fluoridating appropriately. Now, did Tommy Johnson know that, Dr. Johnson? Absolutely. They get those reports. Could he stand up and tell anyone here that that's the case? No, they work to educate the folks in the water plants. They worked with them to see, are you having a problem? You can walk away from a water plant and know whether that water plant is going to change what they're doing or not. Now, seeing that, can he say to a city councilman or council person or a city manager, hey, your fluoridation system, your water plant's not fluoridating appropriately. You should have it right. No. Why is that? Because there's a line that goes from education, and you take your pinky toe over and you say, we should have fluoridation continue. That is considered political advocacy because it's something that will be voted on. Yeah, it's pretty stupid. I mean, they're the ones that had the knowledge to share on what's going on in the community. It behooves us in the private sector to get involved. And what the neat thing is, when you bring them in with you to go to talk to a council member, their handcuffs are removed. Now we can say, can you go over what's happening in our community? And whether we have fluoridation or not, there's still going to be decay. Fluoridation doesn't stop all cavities. It's multifactorial. But when they come in, if they don't think to ask something or answer something, I'll turn and say, well, could you explain this, or could you talk about that? And they can talk about anything. Politically, they're not in trouble. So we, private sector, that's me too, had to learn to do this. You all saw some mouths drop open when I said that, but you are the ones that this is for. These presentations are for. Once you bring them in, unleash them, everybody learns. You don't learn, you get voted out of office over it. Fluoride works both by ingesting it and also by topical application. Systemically, fluoride gets into our developing teeth, permanent teeth, before they come in the mouth. By the age of 8, the crowns on our teeth, our permanent teeth, have formed completely and hard. The fluoride gets into that enamel as fluorapatite, which is more resistant to acid attack when they come in. Hydroxyapatite is what would form if we did not have fluoride available systemically, and that's more easily attacked by fluoride. So if we don't have the pre-erupted benefits of fluoride in those teeth that are developing, they are going to have more cavities, absolutely have more cavities than they would otherwise. So it's getting into the crowns and it's getting into the roots of the teeth as they develop. Now, topically, what we have toothpaste with fluoride, we have mouth rinses, professionally applied varnishes, and those in public health know that you can't reach everybody with it. Fluoridated water also works topically. We say that it is the amount of fluoride, it is a low-level concentration constantly in contact with the teeth that gives us the maximum cavity reductions. Okay, so am I drinking water all night long? No. So where's that fluoride coming from? It's coming from the tissues in your mouth. Your tissues get fluoride onto the tongue, onto the cheek, on the roof of your mouth. And there's this little thing called plaque on our teeth. Plaque's pretty stupid. Plaque likes to take fluoride and pull it in through it, and it places it into a little reservoir between the tooth and the plaque. So at nighttime, when plaque is trying to attack your teeth, there's fluoride being released from that, fluoride being released from your tissues of your mouth. So it's a low-level that's in constant contact with your teeth that is giving you your maximum cavity reductions. So we need both, as Matt said, toothpaste and fluoride. And the question comes up, well, why do we need both? Because mainly it works topically. Opponents will say, even the CDC says it's primarily topically is how fluoride works. Well, I never have in all my years of education ever had a primary without a secondary. Secondarily, it works by becoming incorporated into the teeth before they develop. So it works both ways. Fluoridated toothpaste will reduce cavities by about 25%. You add fluoridated water onto that, it's an additional 25% at least. I'll tell you it's more like 50%. So both of them work together. Neither one replaces the other. Why do a group of people oppose water fluoridation? Only God knows. There are those at the top that people will say, well, why do they oppose it? And I'll say, only God knows. And the executive director of the lead group, Fluoride Action Network, which is the ones that fight against fluoridation around the world, they're based in the U.S. The executive director, one day, we were at a meeting, and he was trying to convince the county to stop fluoridation, giving IQ issues and all kinds of problems. We had a lunch break, and he said to me, Johnny, I would like to be there when your maker asks you why you forced this known neurotoxin upon his children. And I said, Paul, I'd like to be there when your maker asks you why you withheld this effective and safe public health measure from his children and caused pain and suffering, to which he spun around on his heels and walked out of the room. Facts are, they don't care. They don't care who gets hurt by it. It's all about me, me, me. Well, I'm sorry, I have disdain for folks like that. Systemic health risks are where you really need to focus on, folks. That's where the rubber hits the road. We were at a meeting last week, Matt and I, at the American Dental Association, a National Fluoridation Advisory Committee, and one of the members is a pediatrician, and he said the issues that they see with kids with a lot of decay and abscess teeth are infections in the face, infections in the body, systemic infections, abscesses with septicemia, brain abscesses. This area of the face is called the triangle of death. And it's because infections will spread rapidly into your cheeks, down into your throat, into your bloodstream. Now, pus from an infection, dental abscess, is going to go somewhere. It doesn't stay in one place. Now, on the bottom, on the right side, you all recognize that as an infected tooth. If you don't, it's that brown, gnarly, stained or eaten up tooth with a pus pocket on the side. That was me. It wasn't my picture. That was me growing up, and it would get big enough and I'd bust it and have a nasty flavor in my mouth, and I didn't know what it was. I was in enough trouble being an ADHD kid that I didn't want to tell Mama I had something else going on. But this pus will get in your lungs, in your airway, and close off your airway. It will get into your lungs and cause a aspiration pneumonia, a lung collapse. It gets into your brain, causing an abscess. Brain abscesses can cause septicemia, strokes. It goes everywhere. One of the oral surgeons, my wife's a hygienist, and she does billing and coding. Hospital he goes to, anytime they have someone die of sepsis, he's the first call they make. Come in and see if it's dental related, and many times it is. So it's listed as a heart attack, or it's listed as a brain abscess for the cause of death. Second or third thing down the toe tag is an abscess tooth. So it's much more common that we know. We've seen children like this with a swollen face. The eye is the telltale sign. That child is ready to blow an infection somewhere else other than just in the mouth. And the area right behind that eye is a vein plexus that is called the venous cavernous sinus venous plexus. It has no valves. It's one of the few areas in your body that veins don't have a valve. That infection gets into that area. It can go back up into the brain and cause an abscess. It can cause a brain abscess or stroke. Gets down in your throat. Infections which close off the airway can go everywhere. And this is a picture of Ludwig's angina. It's called Dr. Ludwig. I hate how they name things after themselves. But this is an infection that spread under the chin. And I know this picture's good. I use this when I send it to decision makers. because they don't a lot of times like pictures. Please don't send me any more pictures. Well, you just signed your warrant that you're getting 1,000 more pictures. If you don't like to see it, that's on you. This is what you cause by stopping fluoridation for your families. How do we know fluoridation is beneficial? There's no argument that benefits of fluoridation. Study after study after study have demonstrated, and this is just a couple of them, were National Health and Nutrition Examination Survey, NHANES it's called. It's an ongoing evaluation across the country. They continue to find cavity rates that are at a 25% reduction. Now, for those of you in the private sector, a 25% reduction is just by looking in the mouth with a mirror and a tongue depressor. You do not take x-rays in public health surveys because those kids that they're examining and adults may have a dentist who has taken x-rays. So when you see a hole in a tooth, that's when they're saying 25% cavity reductions. We know on x-rays that we're going to see a ton more things, more severe and more cavities in these kids and adults that don't have fluoridated water. In permanent teeth, they saw 9 fewer decayed surfaces in a classroom of 30 kids between fluoridated and non-fluoridated. Same around the world. Studies across the world have shown the same things. It benefits greatly. Huge reductions in cavities. Now this is the exciting part. What happens when fluoridation is ceased? And I say it's exciting because now we finally have data to show what goes on. Opponents will tell you that fluoridation stops 1 cavity in 40 years' time. We know that's not the case, but now we have excellent studies out of Israel, out of Windsor, Ontario, Calgary, Alberta, and Juneau, Alaska. This was a Juneau, Alaska study that was done after fluoridation stopped when a nurse researcher moved to Juneau, the capital. And she saw kids on the playground had black teeth. And she's like, what's going on? Well, she found out that they had stopped fluoridation. And so she bought Medicaid data from when fluoridation was in place and when it ended. And what she tracked was under the age of 7, kids with water fluoridation or the ones without water fluoridation had 1 more cavity-related procedure per year than those that did have fluoridated water. 1 more. Take a classroom of 20 kids. First year, these kids without fluoridated water have 20 more cavities. The next year, they have 40 more than their cohort would have had. The next year, 60 more. Now, this is a picture, my friend Matt made this up. I love it because this speaks loudly to anyone that looks at it. And decision makers can go, I can't really ignore that. They might want to. They might lose their job. I keep saying that because they do lose their jobs over this. Calgary, Alberta, Canada, you may have heard of. Calgary, like in our county in 2011, voted to stop fluoridating water. A researcher there was looking at Edmonton and Calgary for different studies, and one of them was decay rates. They both are fluoridated. Well, in 2011, Calgary's City Council decided to stop. It wasn't science, it was money and personal opinions on fluoridation. By 2018-2019 data, Edmonton had kind of gone up a little bit and then back down to 55% of the kids in 2nd grade having at least a cavity, 1 cavity. Calgary shot up past Edmonton. They were now, instead of like 48%, they were at 65% and still climbing. When did they start fluoridation back? 1 to 4 days before we lost it last July. What happened in the interim, we're never going to know. The opponents hammered Dr. McLaren so much, they scared her from doing any further research. She'll never do any more. So we know that this is going to be a lot more. Florida lost fluoridation last year to over 15 million people when they outlawed it in my state. 15 million people. You think we're going to see Calgary in our kids? Yeah, we are going to see that. We'll have it back before it goes too much longer. But there's going to be political turnover. And if you're listening, folks, there's going to be political turnover. You know that from when I started, and you know that we can get it done. Hospitalizations for treating these kids in the operating room under general anesthesia also went up. In Calgary, they went up 78% after fluoridation was stopped. Edmonton had a little rise in 12%, but diseases come and go up and down. But Calgary was not a going up and down. They have gone up to 78% increase, and I guarantee you it was much higher than that now. They just got it back. Deaths do occur from hospitalizations, let's face it. Putting a child under, having them taken from your arms, taken from a parent, taking that child in the operating room, putting them on the table, and letting an anesthesiologist put them to sleep and within an inch of death, which all of us do, but kids, it really hurts to see that and to do that. Put them to sleep and then hope to God they wake back up, and you're tearing up everything in there to try and fix it fast. It's very expensive. This is $10,000 to $15,000 is an estimate, and I know a guy in North Dakota who paid for his employee who didn't drink the fluoridated water or use toothpaste. He paid for it out of his own pocket for him. He said it was about $15,000 to have that done. Who are the best people in this country and around the world that stop more cavities than anybody else? It is the water operators. By fluoridating the water, they stop 2/3 to 3/4 of children going to the hospital for treatment under general anesthesia for full mouth rehabilitation. They do more than all of us together could ever do in our entire lifetimes. They aren't taught that. They're taught how to take care of it, how to do it. When they see this, many of them who have opposed fluoridation come up and say, I never knew that. I am totally in favor. I had no idea we affected public health like this. They also provide us with safe drinking water in our aging infrastructure. That is a tough thing to do. So always go see your water plant. I can't impress upon you enough to go visit it. You might want to take your lunch because you could eat off their floors. It is that clean in those places. Go in there and look around. Thank them for what they do. And they fluoridate, thank them even more. And if they're not happy or concerned, they're concerned about it, you're a scientific resource for them to help them out. When they see this one, it's like, hold the phone. I have given, this picture's been in the Wall Street Journal and NBC News. It's been all over the media because this is one, when I present, that they take pictures of, because this is the difference between someone that's having to go at a younger age and be ripped apart and fixed up. How would we like our children to have this? How would anyone like this when we can prevent such a large amount of this from happening? How do we know water fluoridation is safe? Which is a good question. It's questioned a lot. Well, there have been scientific panels of experts around the entire country and the world that get together from time to time. In some countries, it is mandated that they must do these reviews every few years. England just came out with their 4-year review. There are no health issues. It's very effective in stopping cavities, and there is no health issues, including IQ, cancer, or anything else. In Ireland, they are charged with only looking at harms. They cannot look at benefits. There has been no health effects, zero, at levels in water fluoridation. In Canada, where these studies that were out of Canada came out saying that fluoride in the water of pregnant mothers is causing IQ deficits. The Canadian Agency for Drugs, Technology and Health is an independent agency. It's now called the Canadian Drug Administration. They independently looked at that very first study that came out in 2019, stating that boys had a 4 to 5 point deficit in IQ because of fluoride in the water. And they said it's absolutely that your data does not support your conclusions. And it's been the same ever since on every other study that came out. Now, how about IQ? This is exciting because we have a lot of IQ questions come up. And who wants to know more about this than us? Let's face it, as dental professionals, we are horrible business people. Who advocates for something to create less business for ourselves? Truly. So I mean, for that reason alone, anyone should understand that something that we're talking about, that we're promoting, is got to have something good to it. First of all, it fights the most common chronic disease around, which RFK Jr. says he is looking to get rid of those most common chronic diseases. Well, guess what? Fluoridation we want to do away with. Fluoride supplements we want to do away with. There's an agenda. The National Toxicology Program and these other studies that looked at spot urine samples, they took from a database of information, they went and they shopping for different things. And they had a fluoride sample, a single spot one from first trimester, second trimester, and third trimester that they looked at. They looked at the fluoride content of it. Now, a pregnant mother urinates at least 2,300 times over their pregnancy. So you're going to take 3 analysis and say, I can tell you how much your individual fluoride intake is for your entire day by looking at 3 samples. Fatally flawed. The thing is that they used, I'll get to that in a minute. NTP analysis was one that was done, and that came out last year, and it was widely painted up and in the media. What they looked at was studies from around the world, and in other countries where fluoride levels are high, that doesn't apply to the U.S. There were no U.S. studies they could look at. They looked at these Canadian studies, and they considered those to be of high quality and very low risk of bias, meaning there had something flawed within them. Well, they got it wrong. And there's groups out there that have written over and over that you are absolutely misclassifying these studies. So out of 74 studies that they used, 70% of them, they even said that, were not valid, but they included them in their analyses. There were only 7 studies that looked at fluoride levels below 1.5 parts per million, which you're hearing, oh, below 1. Or at 1.5, we're getting IQ changes. That's not from the U.S., and it's not accurate. Only 7 of them were there, and none of them showed any issues whatsoever. Here's where they really messed up. And I had an opportunity to speak at the same meeting that they were speaking at a couple of weeks ago. I like riling people up with my ADHD, and I got them very angry, and they said some things that were not accurate on the record. What they did was they said that looking at fluoride levels, the spot urine analysis, they can tell every mother based on what your output was of fluoride in your urine from this one sample a day, how much your total intake was for the day. Now you know you can't do that. And they quoted this gentleman from England, Andrew Rugg-Gunn. Him and others have done studies, as well as the World Health Organization. They say that you cannot determine that for an individual. You can look at that for groups of people, and even 24-hour samples for groups of people, and give an estimate of what their fluoride daily intake was. They totally misquoted it. That should have just taken this piece of paper and just thrown it out. They weren't happy when I said that, and I didn't care. I'd lose no sleep. This is what Andrew Rugg-Gunn wrote me a letter on so that I could get out and say it in public. You'll have all this. He was hot. So where do we kind of look at these IQ studies? Matt mentioned, I believe, the one in New Zealand, which was a 38-year study. We has had a new one, which I'll speak about in a minute. The Canadian study that came out in 2019, talking about the boys having a lower IQ. Well, what they did was they beat up the data. They abused the data until they found some sort of an association. What was their number one thing they were looking at was the difference in IQ of kids from mothers that lived in fluoridated versus non-fluoridated water. Did they put that in their report anywhere, their publication? Yes, they did. Did they talk about it? No, they did not. It's in the table on line 11. It's buried. But there were no differences in IQ. All across these different studies, no difference. Yes, fluoridated areas had a little higher. Does that make a difference? No. I mean, it's the same thing. It does not make a difference. These groups of folks, these studies, these are just a smattering of things that have come out on the studies that were done in Canada, plus the NTP report. They have been just so bashed over it because it's horrible, horrible work that's been done. It's the only review that's ever been done where they said that there's an IQ problem from fluoride in the water. It's an aberration. Now, there was a great study that came out in November of last year, and the second one the gentleman just published, we didn't know it was coming. He was studying people from a young age all the way to age 60, and he looked at their cognitive testing in high school and then again at age 60. So if you're having IQ issues from fluoridated water at a young age, you should see it your entire life. And what they found was people who had fluoridated water part of the time or all the time growing up, at age 60, it was their minds were still functioning the same. Those that didn't have fluoridated water performed worse. They had 27,000 people they followed that entire time. So what are we at? What's the only risk of fluoridated water? It's a little bit more of dental fluorosis, which happens in non-fluoridated areas as well from people swallowing toothpaste. So the normal and questionable, that's not even an issue. It's like we can't even see anything on there. These teeth are blown up under dried off and under a bright light. You may see the very mild has a few little white specks. The mild has what we call snow capping. That all wears off your teeth. It wears away within like 3 to 4 years. As pediatric dentists, we can tell you it goes away. We can see that. Moderate fluorosis happens from swallowing toothpaste, from swallowing fluoride rinses, and also if you're taking fluoride supplements when you're in a fluoridated area. That does happen, and it's inappropriate, but those things are happening, and we're working to try and help others to know that's not appropriate. Severe dental fluorosis never occurs from fluoridated water. You would have to have 2 parts per million, 3 times what you are supposed to have in the water, like in Birmingham. That's not there. You would have to have 3 times that amount to show anything like this. Around the world, leading health and scientific organizations totally stand behind water fluoridation. No credible scientific or health organization in the world opposes fluoridation. But I bring it down to decision makers. I say, look, if you don't want to believe, you got to do your own research, because there's over 7,000 pieces of literature on water fluoridation on PubMed. You want to read all that because you need to be an expert. Other people have already done it, but just listen to 2 groups. American College of OBGYN, who cares for your wife or spouse or significant other when they're pregnant. And listen to your pediatrician. Both of those groups back water fluoridation as effective and safe. Would they do something for your gem of your diamond gem of your life and do that and harm your child? Hit your head on a bedpost and wake up, folks. I don't say that, I think that. Is there any replacement for water fluoridation? No. You can take supplements, but that's so tough to get done. You got to forward it on and on and on. It also doesn't benefit adults. And I have a little quick one to finish up, but fluoridation gets the right amount of fluoride to everybody in the community on a day-to-day basis with them having to think about it. And don't say drink fluoridated water. What about bottled water? People are drinking bottled water a lot. Well, yeah, they are. But they're using the water to boil their foods in, pasta, they're soaking it up, rice, soaking it up, they're mixing it with drinks. They're also making me, for their kids, and then for me, maybe with my scotch, but you're getting it in place. And even with the bottled water consumption, the NHANES studies continue to show there's at least a 25% cavity reduction. Supplements stayed on the market. RFK Jr. tried to pull them last year. Ended up on Halloween Day, he came out and said, well, they're going to stay on the market, but under the age of 3, you shouldn't use them because they cause a gut issue for kids. It does not. We are the prescription pad holders. We prescribe them the same as we always have. He told the industry that makes them, don't market it to kids under the age 3. He cannot tell us not to prescribe them, which is the appropriate thing to do. These are 2 groups out of all of them that definitely say use them. If you don't have optimal fluoridated water available to you, you are at a high risk of decay. You are at a high risk by the definition of it. Here is the chart, I think it's from 1996, it has not changed, on if you have fluoride in your water, you always have to test your water before prescribing a supplement, because some water contains a fair amount of fluoride. And as I was explaining earlier to someone, this young lady here, 12 million people in the U.S. have naturally fluoridated water at the right amount because it erodes enough fluoride out of the rocks on all the way into the surface. Jacksonville, Florida, 1 million people, naturally fluoridated water. Some of the best schools in the state, their heads aren't on backwards, they don't have a third eye on their head. There's nothing wrong with it. They banned it in Florida, adding it to it. Did they do anything to Jacksonville because of these IQ issues? No. It is all about politics. It is MAGA now. It was Tea Party back in my county, and it's circled around. I'm Republican. I can say this. I'm not one of those Republicans. And finally, actions have consequences. This is me on the left-hand side. I was in Toothy, outside a polling place, 100 feet away, and the two candidates that were running to replace these two that had voted it out were Janet Long and Charlie Justice, former state legislators. Great people. Their whole platform was, we will return water fluoridation the first day we're back in office. 15 months after we lost it, we had it back. 700,000 people regained it. So we will do what we have to do. And that's on the private sector to get it started, and everybody will work together. And the media won a Pulitzer Prize on their editorial series they wrote against the Foolish for Fluoride group. They won a Pulitzer, which is the top, Matt will tell you, it's the top award that you can get in the media. It's fantastic. Thank you all very, very much.